My first presentation, which is on energy conservation for post-viral fatigue. My name's Selina Walters and I'm an occupational therapist in the Havering Community Learning Disability team. And before I worked here, I did work in a chronic fatigue service, so hopefully I should be a bit well placed to chat to you about post-viral fatigue and the different things you can do to help yourself to start to feel a little bit better or to help somebody else. So what will we cover? We're going to look at what is post-viral fatigue. We're going to talk about the 3 Ps principle, which is to pace, plan and prioritise to help conserve energy. We're going to look at practical tips and advice, rest, diet, routine, so how best to organise your day to still achieve what you want whilst also conserving energy and helping you to feel better. I should say that we are not going to look at sleep in this presentation because that's going to be a separate one, which I'm going to do next for you. And the information we're going to look at today is relevant to anyone recovering from COVID-19 or any other viral illness, which you don't always, but you can develop post-viral fatigue from. And it's relevant for anyone, so either for yourselves or if you're looking after somebody with a learning disability who is recovering themselves from a viral illness and might have post-viral fatigue. So it's really helpful for anybody. So what is post-viral fatigue? So it's very normal during or immediately following illness to feel more fatigued, more tired, but you should have quite a quick recovery. So post-viral fatigue, anybody can develop it, and it's just when you start feeling unwell for an extended period of time after the virus, when really you think you should be starting to feel a bit better. So it can affect people differently, but some of the things you can experience are difficulties with sleeping, increased pain or aching in your joints, especially after you've done an activity, you would feel more pain and more fatigue, and problems with your concentration or memory. So people who live with more chronic fatigue for a long period of time would call this brain fog. So it's when you have difficulty remembering things, you can't remember where you've put something, and sometimes just holding a conversation can be tricky. So the 3 Ps principle, this is really good to remember. So if you don't take anything else away from the presentation, this is a really good thing to try and remember, because it will help you to start on the road to recovery to feeling a bit better. So to pacing yourself. It's important to, when you're thinking about the different things you've got to do in a day, to remember to take regular breaks, to break up activities into little chunks. So you don't have to do something all in one go. You can do a little bit, have a little rest and a sit down, do a little bit more. For example, if you were doing the washing up, you don't have to do, if you've got a lot to do, you could just do 5 minutes, have a little 10-minute sit down, do another 5-10 minutes. Oh, we've gone off the slide. And if you're going to do 2 different activities, it's good to do one thing and then maybe have half an hour, 45 minutes before you go on to do something else. So you'll have a half an hour, 45-minute rest in between. And like I put on the slide there, it's very important to stop before you feel tired. So don't carry on ploughing through to the end of something if you know you're going to feel exhausted afterwards. It's much better to split it up into 2 chunks so that you can complete the activity without really overdoing it for yourself. The next thing is to plan. So you would organise your week so that your activities are spread out, especially your more strenuous activities or things which you find more strenuous. So for example, if you were going to go shopping on a Monday and then you knew you had to do your laundry, which might be strenuous for you as well, I wouldn't do that on the Monday and not even the Tuesday. You might spread that out until later in the week, say the Wednesday or Thursday. So it can be good to use a bit of a planner or just your calendar, or just think about how you do things so that you're just not doing everything all in one go. You need to plan it out and break it up and spread it out. The last thing is to prioritize. So think about what's essential for you to do and what's also important for you to do. So it's good to have a nice balance between things that you know you have to do, but then also things that you want to do. Because when we feel fatigued, quite often the first thing to go is the leisure, the things which make us feel good. And actually that's really important to still try and keep into your day, into your routine. So you might have to do a bit of cleaning, but also try and put in there chatting to your friends and family, or doing a bit of knitting if that's what you enjoy, just something that you like doing. So if you're supporting somebody with a learning disability with post-viral fatigue, you want to try and help them to pace, plan and prioritise their day and their week, and also just to help them understand that it is okay not to do the things at the minute that perhaps they always do, or to do them in a different way, and that it's not forever. You'll be able to get back to doing what you normally do, just when you feel a bit less tired. So we're going to move on to some practical hints and tips and a bit of advice now. So getting washed and dressed. Like it says on the slide there, it's good to have everything you need at hand so you don't have to run around quickly trying to find everything. Sitting down whenever you can, really. If you can sit down in the shower or when you're getting dressed, that's good. Is it easier to maybe have a strip wash? And try and choose clothing that's easy to put on. It's important to remember as well that having a bath can be really nice and relaxing, which is good, but a very hot bath can make you more fatigued. I mean, if you do prefer a hot bath, it's just think to have it in the evening rather than in the morning, because then it will help you get relaxed for the night rather than making you feel fatigued in the day. If you've got any assistive equipment, just please use it. So if you've got grab rails or non-slip bath mats, or maybe long-handled sponges, or when you're getting dressed you could use a long-handled shoehorn, anything which just reduces the demands that you're placing on your body. So you don't have to bend down, you don't have to reach, you can sit down and do things. After a wash, either a bath or a shower, or a strip wash, a really good thing to get is a toweling dressing gown. So a big toweling one you just then wear, and you can sit down and have a drink, just have a rest, and the dressing gown will dry you, so you don't need to then be rubbing yourself dry. Another thing is to please ask for help if needed with things. So if there's someone that you live with and you feel comfortable with them helping you out with certain things, then ask them to help you. It's not going to be forever, but if it means that they help you with getting dressed, and then that means you've got a little bit more energy to do something that you enjoy doing in the day, then that's a positive. Make sure you take breaks as well. So don't see that you have to do all your like say your getting ready routine all in one go. So you might brush your teeth and then have a little sit down for 5-10 minutes, and then say if you want to have a shave, maybe then you could have a shave instead of trying to do it all and then sit down tired. Like I said earlier, it's much better to break things up and take little breaks in between than ploughing on through. Also, when thinking about getting washed and dressed, can you adapt things to make it easier for yourself? So if you normally like to have a wet shave, is it easier just for this period to have an electric shave? If you normally use a soap that you have to sort of rub and lather in the shower, is it easier just to use shower gel? Can you use maybe dry shampoo as well if you don't want to have a shower every day, or wash your hair all the time? It's just little things like that which can just make the difference. Also, when you're getting dressed, it's easier to dress your lower half first, because that's a more difficult, more energy intensive part of your body to dress, because you're having to bend down and pull on. And it's good to put your clothes out the night before, so that you can do that when you've got plenty of time, and then you don't have to try and run around and find all your clothes after you've done getting washed and dressed. Okay, so the next thing is looking at things you'll do around the house and making your meals. So alternate heavy and light tasks. So don't think I'm going to take the bins out, then do the vacuuming, then do all the washing up in one go. You know, you can alternate things. So that's all quite heavy tasks. I mean, you'll know everybody's different. So there might be some things that you can find you can do fine, but just know what your limits are, and just be sensible about trying to do heavy things then light things. So light tasks, by light tasks I mean less energy consuming things. So you might do a bit of dusting or just tidying away, or you might even not do any sort of cleaning. You might sit and just do a bit of relaxation or something, which we're going to come to later. Breaking big tasks up into small steps. So like with the laundry, you might put the washing on, or sort it out, have a break, put the washing on. Obviously you've got to have a break when it's on, but hanging the washing out, you might say, if you're going to hang it out, you might not hang it all out in one go. Again, take a break in between. Delegate as well. That's in bold because that's a really important one. At this time, if you're feeling fatigued and there's somebody that is happy to do something for you, just let them do it for you, because whilst you can get back to doing it a little bit gradually when you start to feel a little bit better. But at the moment, it's really important when you first begin with post-viral fatigue not to overdo it. So as well, there's different things you can do, like using lightweight vacuum cleaners, using a long-handled dustpan and brush so you don't have to bend down. If you're doing the washing up and you normally dry it all up, can you let it air dry just for this time? Is that okay? Using small bin bags rather than really big ones, so then that's less weight that you have to carry out. And can you sit down to do things? So like ironing, can you sit down to iron? It might not be your ideal method of doing it, but just for this period of time, it can be really helpful. Just stops you having to stand up and do it, which is using more energy. So thinking about meal prep as well, again, is there like different adaptive equipment you could use? If you've got a hot water dispenser rather than using a kettle, that's great. But if not, you could get a little jug to fill the kettle up, so you don't have to be carrying the heavy kettle around. You can get cooking baskets that go inside a saucepan, so again, you don't have to carry a big saucepan full of boiling hot water. You can just lift your vegetables out or whatever you've been cooking in the basket and drain it that way. Again, can you sit down? Or simplify tasks, so don't perhaps, you know, this isn't the time to do a really complicated meal. Maybe stick with simple things that you know how to cook. Batch cook if you can, because then that prevents you having to cook every day. And you can use like cheats ingredients, like you know, jars of pasta sauce, you know, already chopped up vegetables and prepared vegetables, lazy garlic that's already done for you in a jar. Like, there's all sorts of different things. I mean, like people use like already meals within the microwave. So there's lots of different things you can do to make it easier for you. So the next thing we're going to talk about is routine. It's really good to have a loose routine that then you can build on. So start off with a low activity level, and gradually, as you start to feel a little bit better, you can build on it. But it can be good to keep a little planner and to think about having a regular sleep time, wake time, regular meals and regular rests. You need a good balance of activities as well. So some things which are fun, some things which you need to do. And try not to do everything in the morning, because you might think, well, you might have more energy in the morning after a night's sleep and think, I'll get up and do everything, but then you run the risk of crashing in the afternoon because you've overdone it. It's much better to spread it out during the day. It can be better as well if you do have a better day, or when you start feeling better, it can be really tempting to rush back into doing your old, your old life, your normal things straight away. But you need to really err on the side of caution and stick to your sort of graded plan of gradually doing a bit more and a bit more, because you run the risk of overdoing it if you get back to your normal life too quickly. In with that, it's good to have realistic goals. So goals for your day, what you want to achieve. Also, when thinking about work, if you're working, you will need a phased return back into work, even if you're working from home. And your GP can help you with thinking about what that might look like, what sorts of adaptations or reasonable adjustments you might be able to get. And they can also help you with a fit note, which on which they'll put all your information and chat to your employers with you. So how quickly you get back to your normal level of functioning, if you like, really varies person to person. But it's important not to try and rush back into things. And another thing which is good to do and to put into your routine is to try and just get up and move 1 or 2 times a day, even just really gently, or stretching, because that can help with circulation, with decreasing pain, and with helping you to sleep better. I'm going to go on to look at rest now. So it's important to say that rest is not sleep. They're 2 different things, really. Like I say, we'll talk about sleep in a minute in the next presentation. But when we're thinking about rest, it's first of all good to think that every activity you do uses energy. So you might feel like you're having a rest if you're sat down on the sofa watching TV. And you are resting your body doing that, but you're not resting your mind. So you're having to concentrate on the TV, or at very least you're having to process the light and sound which is coming from the TV. So what you want to try and get a little bit into your daily routine is a bit of what we call restorative rest. So that's rest that helps your body to recharge. I mean, everybody's different with how they like to rest. Some people might really enjoy more formal relaxations. So we're going to talk about that a bit later as well. But if you do, there's lots of different things you can access on YouTube, or there's lots of different apps. There's some links at the end of the presentation on for Headspace, which is a really good relaxation app, which you can get a little free trial for. And there's an NHS app library where there's different things you can access as well. So some people like more formal things, whereas other people might just like to go and take a bit of time out with a drink, just sit in the garden, perhaps just maybe do a few breathing exercises. It's a little bit of trial and error. I would recommend you to try relaxation if you're new to it, just to see you might like it. And relaxation is a skill really that you can learn. So the more you do it, the easier it's going to be and the more benefit you'll get from it. So if you just give it a little bit of time before you think you don't like it, but if it's not for you, then obviously that's fine as well. It's good to think that sometimes you can just be sat there doing nothing but still be expending energy. So if you're worrying or anxious about something, that's going to be using your internal energy up, as well as if you're looking on your phone or even just chatting to somebody. So everything you do uses energy. That's why it is good to build in those rest periods. Just a little word about relaxation again. It can really help also by decreasing your anxiety. So if you are having those worrying thoughts or negative thoughts, and because it helps you to get more oxygen into your body, releases your muscle tension, which can help with pain, decreasing pain. It can help you to sleep a bit better, and it can therefore help with decreasing fatigue. It's good to close your eyes when you're trying to rest anyway, because then there's less things that your body is having to process. And the last thing on this slide there is avoid prolonged rest periods. So like I say, up to 30-45 minutes is a good little rest period. What you want to try and avoid is maybe spending all day in bed resting, because then you're not going to feel the positive effects of it, and in fact you're going to get some negative effects really from laying down all day, not being able to do anything. You're not going to get that good feedback that you've accomplished things. Can be really, really difficult if you are feeling really tired and fatigued, but just trying to get some sort of, even if it's a really loose little routine going with a few rest periods in and a little bit of gentle activity, which then you can build on when you start to feel a bit better. That's really going to be positive for you. Another thing we need to look at is our diet. So we all know that eating a healthy, balanced diet is good for you anyway. But when you're thinking about feeling fatigued, it's good to remember that large meals can make you feel more fatigued. That's why everybody falls asleep on Christmas Day after they've had their meal. So it's important to try and avoid that. And so therefore it's good to eat little and often, and to try and eat healthily if you can. Avoiding stimulants is important, because you might reach for caffeine or energy drinks, which will give you a burst of energy, but it's a bit of a false burst. So you'll get a crash after it, and then you'll feel worse, which then you'll have to recover from until you gradually start feeling a little bit better. And you'll go a bit up and down, which you really want to be a bit more stable. So it's good to try and avoid them. If you do want to have a bit of coffee, try and have it in the morning, because it stays in your system for up to 8 hours, I think. So then you really don't want to have it in the afternoon, because it might start affecting your sleep. And one thing to say is it's good to, if you are supporting somebody with a learning disability, just to try and help them to understand why making healthy choices is going to help them to start to feel a little bit better. So moving towards getting better, you should expect that gradually you should start to feel a little bit better. It might be a slow progress. So for some people it can take a few months to get better from post-viral fatigue. Other people it can take a year plus. Things to think about as you are getting better is, like I said earlier, don't rush back into your old life straight away. And it might be that some of the lifestyle changes you've made, like adding in relaxation or taking a little bit of time out, making time to do things that you enjoy, they're things that you might want to keep with you as you move forward anyway. They're probably positive for everybody to do, whether you've got post-viral fatigue or not really. And other things are to think about what has helped you in your recovery process, and try and take them forward as well. So balancing activities, maintaining a bit of a routine, like I say, doing things you enjoy and having a bit of rest and relaxation. Even when you start to feel better, try and keep those at least a little bit into your routine. You don't want to risk overdoing it. If you think that your fatigue's not improving, so you might feel like you've been doing everything that you've been advised to do, you've given it time, but you're still not really seeing any improvement, and you're still feeling the fatigue and the aching muscles and the poor sleep and the difficulty concentrating, then it's probably time to speak to your GP, who might be able to advise you further. And there are specialist fatigue services that can go on to help you a bit more if you need it. Hopefully it won't come to that. So the last page there is just a bit of an acknowledgement. So I adapted some of the information in this from The Royal College of Occupational Therapists have produced a practical advice guides for people during and after having COVID-19. So that's available on their website, which the link's on there. And also I adapted some information from a chronic fatigue service at Epsom and St Helier. They've got some good handouts on their website too, which you can look at on their website there. I mean, they are based for people with chronic fatigue syndrome, but it's quite similar advice. It's all helpful if you wanted to look at that. And then there's two links there. One's for the NHS apps library, where you can access various different sort of relaxation, healthy living apps. And there's a little link to Headspace as well, if you wanted to look at that. But like I say, you can also look on YouTube for lots of different relaxations that you can follow. So I hope that's been helpful. Sorry I can't be here live for when this is going out, but if you've got any questions, my colleagues will hopefully be able to answer them for you. Thank you very much.